and good afternoon. It is noon here in Abundant Health and Wellness Clinic, and it is our Friday Lunch and Learn. And so I'm going to be talking about new research that has to do with acid reflux and long-term use of PPIs. Now, PPIs are protein pump inhibitors, and these go by some well-known names that we all know. So we're going to get right to the research. And this is research today. This wasn't necessarily what I wanted this week. It wasn't necessarily what I had planned to do today, but I always like to stay current, and I like to give you all the information that we can. So it says here that if you or a loved one use Nexium, Prilosec, Prevacid, or another antacid medication and develop complications as a result of use, you know, this is one of those things that you're supposed to call and get an attorney here. But these are the things that people are saying that you can get if you've got acid reflux disease or GERD. GERD stands for gastrointestinal esophageal reflux disease. Yeah, anyway, it's I lost my train of thought there. Okay, anyway, if you are taking any kind of medicines for acid reflux, this is what you can get. You can get stomach or gastric cancer, acute interstitial nephritis, dementia, chronic kidney disease, kidney and renal disease, other kidney complications, bone fractures, okay? So they're talking about these protein pump inhibitors, okay? So I'm going to tell you, I'm going to read this to you. Long-term use of common types of medication used to treat heartburn, acid reflux, and ulcers may lead to an increased risk of kidney disease, kidney failure, research shows. The study, printed in the Journal of the American Society of Nephrology. Now, anything in medicine with the prefix NEPH stands for kidney disease or renal disease. So this was in a scholarly journal, peer-reviewed journal. It adds to prior research that suggests that protein pump inhibitors, or PPIs, a group of drugs that reduce gastric acid production, can lead to serious kidney damage. These drugs also have been linked to double the cancer risk for stomach cancer. So we don't want to do that, okay? So how do these protein pump inhibitors work? The serious side effect, right, is how do they work? Well, it tells me that they're going to tell me how they work. Let me tell you how they work. They tell the little cells in your body that are supposed to produce acid not to produce acid. And this is the problem that happens. You cannot digest your food if you do not have stomach acid. Now, hydrochloric acid is one of the strongest acids that we have, and we have a mucosal lining on the inside of the stomach to protect the actual stomach from the hydrochloric acid. Now, the hydrochloric acid breaks down the food, so the food is already sort of I want to say digested, but it's just the chemical components are broken down. So when it gets into the small intestine, this is where the enzymes are. The enzymes can go further in and chew up that food, extract the nutrients from that food, and get that nutrient-rich broth, I'm going to call it, into the cells via whatever mechanism that they do. In the small intestine is where your uptake of nutrition is. And so if your food gets into the small intestine without being broken down in the stomach, then the particles are going to be too big for the enzymes to work on. And so then you're going to get bloating and gas and all kinds of other symptoms I'm going to tell you. So what people don't know, if you have acid reflux disease or GERD, the symptoms are the same whether you have overactive or underactive. So a lot of times the doctors are just going to assume that you have an overactive stomach acid, and so they're going to give you these protein pump inhibitors that suppress the acid. So this is the problem that we get because the body's very, very smart. There is a gut-brain connection from the stomach to the brain, and so the brain's going to ask the stomach, I can imagine this dialogue, right? Hey, stomach down there, why are you not producing acid? And the stomach says, hey, boss, I can't help it. They've put this chemical in me and I'm not supposed to produce the acid. And the brain says to the stomach, well, I'm the boss. I'm going to tell you to produce more stomach. So actually, more stomach acid. So actually, you can have a rebound effect when you take these protein pump inhibitors. So this is actually how they do work. So what it says is individuals who take Nexium or Prilosec over the counter daily for more than a year, right, particularly individuals who are over 50 years old, may be at increased risk for hip fracture, wrist fracture, and other spinal fractures. Men and women that use Prilosec or Nexium appear to have a 20 to 50% increase risk for acquiring chronic kidney disease compared to individuals that do not. So we don't want to have any kidney disease, and we certainly don't want to have any stomach cancer. So I'm going to give you some more risks of taking this. Now, I'm just going to tell you, this is something that's near and dear to my heart because my late husband suffered acid reflux disease, certainly most of the time that we were married. Now, I put it down to his food choice because he would take and eat jalapeno peppers, just raw, just pick them up and just eat them. He would also eat Indian food, which is quite spicy, and the food would be so spicy that it would actually cause him to break out in perspiration. So I put it down to that. Now, I know now that when you eat foods like that, it actually improves your digestion, so I know that's not the culprit. But at any case, he did suffer this heartburn. He did suffer this reflux. He did have a hiatal hernia. So if you have a hiatal hernia, then you can be more prone to reflux disease, and there are things that we can do for that. The main thing I'm concerned about reflux disease, if you do have over acid, is that acid comes up through that cardiac sphincter. Okay, so think about your esophagus, and I'm sitting down so you can't see, but my esophagus comes down. It's going to take a slight left turn under the breast, and it's going to attach at the stomach right there, and that is called the cardiac sphincter. The stomach is then there on the right-hand side. It's going to connect to the small intestine via the pylori sphincter. So your stomach has an innie and an outie, okay? So if you have a hiatal hernia, that cardiac sphincter is opened, and so instead of the stomach being under that sphincter, the sphincter opens and the stomach acid comes up through and goes into the esophagus. And this is what causes the burning, the heartburn. And it's called heartburn because it's right under the left breast, which is where your heart is. So when you have a hiatal hernia, and this is when that sphincter opens up, the gastric juice comes back up into the esophagus, it can actually burn the esophagus because acid is not supposed to be in the esophagus. So when you do have that acid reflux, it comes up through the esophagus, it burns the esophagus, it causes ulcers on the esophagus, and you develop what is called Barrett's esophagus. Now, Barrett's esophagus is a syndrome. It is a precancerous sign, and what it leads to is esophageal cancer. Now, the reason this is important to me and important near and dear to my heart is because my late husband died of surgical and radiation complications to esophageal cancer. So this is something that's really, really important. So I understand that you may need to take a protein pump inhibitor so you don't have acid reflux going up into the esophagus, and you don't want to get Barrett's esophagus. If you have been diagnosed with Barrett's esophagus, we do have remedies for that, and it will heal in 3 to 6 months. So this is something that's really, really important. So this is very dear to my heart, and so I wanted to talk about that. Now, these protein pump inhibitors, besides leading to chronic kidney issues and double the risk of stomach cancer, it can also lead to a condition called C. diff. Now, C. diff is a problem where you've got these Colostrum difficile bacteria in the gut, and it causes, let me show you what it causes. It causes watery diarrhea 10 to 15 times per day. Gosh, who wants to deal with that? Abdominal cramping and pain that may be severe, rapid heart rate, fever, blood or pus in the stool, nausea, dehydration, weight loss, swollen abdomen, kidney failure. Okay, so here we are back to the kidneys, right? And increased white cell count. So most people get C. diff after they have a course of antibiotics. This is also something that is often acquired after a hospital stay. But this particular report is from the Mayo Clinic, and so it's a very reputable report. And it says these are drugs that are associated with C. diff infection. Taking antibiotics for a long period of time, using multiple antibiotics, taking broad spectrum antibiotics, or taking medicine to reduce stomach acid, including the protein pump inhibitors. So again, this is another instance why we don't want to do protein pump inhibitors unless we're absolutely, it's absolutely necessary. And then we only want to do it for a short amount of time. So we don't want to get this C. diff. Now, people have died from C. diff infections, and so we don't want you to have that. So let me get back to my little blurbs over here, okay? There was a study that was published in February, and it found that PPI use was linked to higher risk for chronic kidney disease, while the use of different kinds of acid blocking drugs called H2 blockers were not. So this is just your PPI, okay? Your PPI use does that, all right? So the second study, which was published in April, found a higher risk of dementia for people who used PPIs compared to those that don't. So us older girls, we don't want to be using these PPIs because we do not want to have kidney failure. We do not want to have a higher incidence of stomach cancer, and we definitely do not want the risk of dementia. Now, as you can hear, I'm having some trouble with my words today, so I apologize for that. I do not know. I have no reason why I should be having trouble, and I do not take PPIs. Just going to throw that out there, okay? So there's a recent study linking PPIs to chronic kidney disease. The study, which included more than 250,000 people, found that the PPI hiked a person's risk of kidney disease by 50%. Now, we have a lot of people that come in that are in stage 1, stage 2, stage 3, and stage 4 kidney disease. And so one of the things that we are asking them is, where are you on the acid reflux medicine? All right, so we want to make sure that we're dealing with that. So I talked to you about Barrett's esophagus. So people who have chronic acid reflux are at a higher risk for a condition known as Barrett's esophagus, which is thought to be a precursor to full-blown esophageal cancers. Some studies suggest that because the PPI protect damaged tissue in the esophagus from repeated exposure to the stomach acid, allowing it to heal, the drugs might lower a person's risk for cancer. Well, this is the thing. You've got to take the risk and the benefit into account. Now, like I said earlier, there are some instances where the lower stomach acid is at risk. And this is one reason why we do iridology, and we look in your eye, because in your eye it'll tell me if your stomach is over acid, or if you're overactive, or if it's underactive. And so we interpolate that. If it's overactive, you're producing too much acid. If it's underactive, you're producing too less acid. Now, too little acid has its own name, and it is called hypochloridria. Okay, say that 3 times fast. So, hypochloridria is a deficiency in the hydrochloric acid in the stomach. Stomach secretions are made up of hydrochloric acid, several enzymes, and a mucosa lining that protects the lining of the stomach. Hydrochloric acid breaks down the food to help you digest and absorb the nutrients such as protein. The stomach acid also eliminates bacteria and viruses in the stomach, protecting your body from infection. So low levels of hydrochloric acid have a profound effect on the body's ability to digest and absorb nutrients. Left untreated, hypochlorhydria can cause damage to the GI tract, infections, and chronic health issues. So what are these chronic health issues? Bloating, burping, upset stomach, nausea when taking vitamins and supplements, heartburn, diarrhea, gas, desire to eat when not hungry, indigestion, hair loss, undigested food in the stool, weak, brittle fingernails, fatigue, GI infections, iron deficiency, anemia, deficiencies in other minerals, including B12, calcium, and magnesium. Also, protein deficiency because you're not getting those food sources digested. Neurological issues such as numbing, tingling, and vision changes. So this is really important that if you have low stomach acid and it presents as heartburn, bloating, gas, burping, all that kind of thing, your doctor's going to put you on a PPI that's going to further lower your stomach acid. So if your stomach acid is chronically low, you can develop lupus, psoriasis, eczema, gastritis, chronic autoimmune disorders, osteoporosis, and pernicious anemia. So as we age, we produce less stomach acid. Okay, as we age, we do. People that are over 65 years of age are likely to have low stomach acid. So on your pH scale, just to kind of remind you of your high school chemistry, on your pH scale, the lowest pH is a 1, which is highly, highly acidic. And the highest pH, I think, is a 10. 7 is neutral. Your hydrochloric acid is a 1 or a 2. I don't have my notes here, so I'm not quite sure what it is. But it's a 1 or a 2. It's one of the most hot acids that we can have, and that's why you've got that mucosa lining in the stomach. Now, hydrochloric acid will protect you from the H. pylori bacteria. Now, H. pylori is at the base of most ulcers. And so if you have an ulcer, if you have SIBO, SIBO is small intestine bacterial overgrowth, you could have this H. pylori. And H. pylori is a corkscrew bacteria. It screws itself down in the mucosa lining at that pyloric sphincter. So if you missed all the anatomy lesson at the beginning of the video, you might want to go back and look at that. But that H. pylori, and I guess they call it pylori because it's in the pyloric sphincter, right? It burrows itself down in there, and the doctors are going to give you strong antibiotics in order to kill that H. pylori. The problem is, because it's such a corkscrew bacteria, it screws way down in the mucosa, and so the antibiotics may not get it. Now, we've got remedies that we can give you that will get down there and get it. But we don't want you having that, okay? Also, surgeries to reduce the stomach, such as gastric bypass surgery, also reduce stomach acid. So this is an interesting thing because I have a girlfriend, and well, I know many people that have had gastric bypass surgery or the sleeve or whatever surgery you have. The surgery is for weight loss because you can't lose the weight. It's a chronic condition, and so they go in and make the sleeve, or they cut part of the stomach off, or they bypass the stomach altogether. Whatever they do, whatever kind of surgery that you've had done, it messes up the internal lining of the stomach, and it causes the production of hydrochloric acid not to be there. So this is what we find with our patients that have these procedures done for weight loss is that they have very, very low stomach acid. And so this particular story that I'm thinking of, the person ate some broccoli. It was fresh, raw broccoli. And 3 hours later, because she was not able to digest it, that broccoli came back up, and it was just as fresh and clean, and it smelt and tasted like it went down the first time, which is kind of a gross thing, because normally when you know, everybody's vomited, and you know that when you vomit, it tastes nasty, right? Because you're vomiting up partially digested food. Well, this particular emesis came back almost in the same shape that it went down. So that led me to believe that there might be 0 hydrochloric acid. So we gave her a supplement of hydrochloric acid, and the last report I heard is that nothing was coming back up and that everything was being digested. So there is actually a test that you can do, and your doctor can do this. Stomach secretions usually have a very low pH, a 1 or a 2, which means they are very highly acidic. Your stomach acid, they can test this. I'm not sure exactly how they test that. You have to go to the doctor. Less than 3, you've got normal stomach acid. 3 to 5, you've got hypochlorhydria. Greater than 5, you've got achlorhydria, which means no stomach acid whatsoever. So this is something that's really, really important. If you have some of these symptoms, now normally if you've got gas and bloating and heartburn and all that kind of stuff, especially if you've got leaky gut, if you have SIBO, that kind of thing, we're really going to be looking at Candida as one of the main contributors to that. But if we're working with you and we're giving you supplements to get rid of fungal infections and you're still having these symptoms, burping, bloating, heartburn, it may not be the Candida. It may be that it is this hypochlorhydria. So I know it's a big mouthful. I bet you guys are practicing saying that 3 times fast, okay? Let me see. Okay, out of about another test, this is another test, 70,000 people diagnosed with esophageal reflux disease, GERD, roughly 45% were taking PPIs, right? Of those PPI users, 16% were more likely than those who were not taking PPIs to have a heart attack. So again, you know, there's a gut-brain connection, there's a gut-cardio-brain connection. So when you're messing with the stomach, when you're messing with everything that's going on, you're actually disrupting some communication here, and it's going to have some dire effect on you. So how can you correct stomach acid? So I have a paper. Let me see. Maybe I didn't get that paper off the printer. One of the things, yeah, I guess I didn't get that off the printer. So if anybody in my office is watching and listening, they could bring me that paper, that would be great. But I did read the paper, and it said, quit eating processed foods. Processed foods contribute to low stomach acid. You want to eat more fresh, raw vegetables. That also increases stomach acid. You can take apple cider vinegar, and that will increase your stomach acid. We've got supplements here in the clinic that are HCl. It says HCl. Some people call it HCI, but it's hydrochloric acid, betaine HCl. And so we've got those supplements here. So if you're having issues with this, we don't want you going into kidney failure. We don't want you having an increase in stomach cancer. We don't want you getting kidney stones. We don't want you having a heart attack. And we don't want you to be having this heart attack and dementia. So these are very, very serious things. I'm going to see if I have all of my papers here that are helping me with this. Okay, so back to the C. diff. If you have C. diff, you can die. I told you that. But it leads to kidney failure, toxic megacolon. Now that doesn't sound good. Toxic megacolon is a rare condition where your colon is unable to expel gas and stool, causing it to become greatly distended. Left untreated, the colon may rupture, causing bacteria from the colon to enter your abdominal cavity. An enlarged, ruptured colon requires emergency surgery and may be fatal. So, does this happen often? No, it doesn't happen often. We don't want you taking PPIs without knowing these risks long term. So there are things that you can do short term. There are things that you can do by changing your diet. There are supplements that you can take. So we want to make sure that you understand, if you are a smoker, smoking is something that increases hypochlorhydria. Okay, so we want to make sure that that's something that you know that it's being harmful. We know it's being harmful to the lungs. We know that it's got cadmium. Cadmium is a heavy metal. We know it causes kidney disease. So there's all kind of things with that. So I think that's all of the information that I have. And I'm a little bit short on my information. You've got 5 minutes to spare. So thank you guys for joining me. I want you to have a great weekend. I know it's back to school. Everybody's busy and that kind of thing. I hope you have enjoyed this. If you have any questions about leaky gut, acid reflux disease, hypochlorhydria, anything like that, just let me know and we'll be happy to answer them on this post. You guys have a great weekend. Love you guys so much. Bye-bye.